The following segment is sponsored by Bristol Myers Squibb. In the U.S., 1.5 million people are living with or in remission from blood cancer, many with B-cell lymphomas, which commonly affect adults over 60 but can occur earlier. Astrid, diagnosed with lymphoma at age 29, joins us today with Dr. Matthew Lunning to discuss the prevalence of B-cell lymphomas and the role CAR T-cell therapies can play for some patients. Welcome to the show, you guys.
Hello.
Hi, Dr. Lunning.
Thank you.
Absolutely. Dr. Lunning, let's start with you. Tell us about blood cancer and what is there a particular type you are here to discuss us with today?
Absolutely. So I'm a blood cancer doctor specializing in lymphoma, and I was a part of clinical trials bringing up Breyanzi, a CAR T-cell therapy in relapsed refractory large B-cell lymphoma. Astrid and I are compensated for our time today by Bristol Myers Squibb. Large B-cell lymphoma is the most common non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma makes up over 60 different kinds of lymphoma. Large B-cell lymphoma is an aggressive lymphoma where many patients are symptomatic at the time of their diagnosis. The median age is 66 years of age.
Well, it's just so hard to go through all of these. Astrid, I just want to say thank you for being here today, and you're a true superhero. Where does your journey with blood cancer begin, and what impact has it had on your life?
Yeah, so I was diagnosed when I was 29 years old. I was in the prime of my life, recently married, and I started having itching all over my body, night sweats, fatigue that got worse over time, and eventually I ended up in the emergency room with chest pain. And at that point, I was told I had a huge mass inside my chest. And a biopsy later, I was told that it was large B-cell lymphoma. I was shocked to hear the news, but then, quickly went into aggressive chemotherapy for about 6 months. And then, unfortunately, right when I thought I was done, the cancer came back very quickly. So at that point, I had two choices that my oncologist told me. It was either a stem cell transplant or a clinical trial that had CAR T-cell therapy. And I ended up choosing the CAR T-cell therapy.
Well, you are such a strong warrior, like I said, and thank you for being a voice for so many others. Dr. Lunning, what are advantages in treatment have been able to be made with people with blood cancer, and what is CAR T-cell therapy?
Yeah, so if you think about relapsed refractory large B-cell lymphoma, about 40% of the patients will have either relapse or their lymphoma won't have gone away after first therapy. And for 30 years, we had tried higher doses of chemotherapy, and in those patients that had a response went on to get an autologous stem cell transplant. CAR T-cell is actually using your own immune system, T-cells removed from Astrid in this case, sent off for manufacturing and re-engineering to make them better killers of lymphoma. They then often return to the same vein and where they came from. And in the Transform trial, the CAR T-cell went head-to-head with this 30-year standard of care of further chemotherapy. And in this trial, the CAR T-cell did get about a 75% complete response rate, and we knew in those patients who could get into a complete response that response could be durable, and that was what was shown in this randomized trial in adults. It should be noted, though, that CAR T-cell does have toxicities, including cytokine release syndrome, neurotoxicity, and the potential for secondary cancers. So it is incredibly important that if you do choose to get CAR T-cell therapy, that you continue to follow with your healthcare team. If you'd like to hear more information about CAR T-cell, you can go to Breyanzi.com. I'll spell that out for you, BREYANZI.com.
Well, thank you so much for all you do, Dr. Lunning, and Astrid, thank you as well. Thanks for being on the show.
Thank you so much. We appreciate it.